Are you aware that mini strokes, frequently ignored, can serve as crucial warning signs for something much more serious? Many elderly individuals experience these silent signals without recognizing their significance. Today, I will tell you 6 silent warning signs of mini strokes in the elderly that you should never ignore. So what exactly is a mini stroke? A mini stroke occurs when blood flow to a part of the brain is temporarily reduced or disrupted. Unlike a major stroke, the symptoms of a mini stroke are temporary and last less than 24 hours before resolving on their own. While the symptoms seem harmless because they disappear, this does not mean a mini stroke is any less serious. On the contrary, a TIA is a precursor to a major stroke. Research has shown that individuals who experience mini strokes are up to 10 times more likely to suffer a severe stroke in the future. The first sign to look out for is face drooping. If you notice that an elderly loved one's smile suddenly looks uneven, or one side of their face seems to sag, this could indicate a mini stroke. Face drooping often occurs because of weakness or numbness on one side of the face, which makes it a highly noticeable symptom. To test this, ask the individual to smile. If one side doesn't move as naturally as the other, it is a strong sign that something may be wrong. The second warning sign is arm weakness. Weakness or numbness in one arm is another common symptom of a mini stroke. You can check for this by asking the individual to raise both arms in the air. If one arm drifts downward or they struggle to lift it at all, this could be a clear indication of a problem. Even if the weakness feels mild or temporary, it is not something that should be ignored, as it could signify that a mini stroke is occurring. Speech difficulties are another silent yet significant symptom of mini strokes. If a loved one suddenly has slurred speech or difficulty forming or articulating words, this is a serious warning sign. Sometimes the person may not even notice they're speaking unclearly, so it is up to you to pay attention. You can ask them to repeat a simple phrase. If their speech sounds strange or garbled, seek medical attention immediately. Sudden vision changes can also signal that a mini stroke is occurring. Vision issues such as double vision, blurred vision, or loss of sight in one eye often come on suddenly and may resolve quickly. However, just because these changes go away does not mean they are insignificant. If someone mentions experiencing temporary vision loss or sudden blurry vision, do not brush it off. It could be a critical warning sign of an underlying issue of TIA. Another important symptom to watch for is confusion and dizziness. If an elderly person suddenly seems disoriented, has a problem understanding simple instructions, or appears unusually confused, this can be a red flag. Along with confusion, dizziness, or a sudden loss of balance can also occur, making it difficult for the person to stand or walk properly. These symptoms can happen quickly and often make the person feel unsteady, as though the room is spinning. Since confusion and dizziness are easily dismissed as signs of aging, finally, pay awareness to numbness or tingling in any part of the body, especially in the arms, legs, or face. People experiencing a mini stroke might complain of a sudden tingling sensation, similar to pins and needles. In more severe cases, they may lose complete feeling in a limb or part of their face. This symptom might seem minor or temporary, but it is a strong indicator of an interrupted blood flow to the brain and should not be taken lightly. Identifying stroke symptoms is just the first step. Responding quickly is essential. Use FAST to remember what to do. F for face drooping, A for arm weakness, S for speech issues, and T for calling emergency services. Acting fast is crucial, even if the symptoms seem to go away. Ignoring these signs can result in a higher risk of a full stroke and long-term brain damage. Early treatment helps reduce these risks. Caregivers should watch for mini stroke symptoms like face drooping, arm weakness, speech problems, vision changes, confusion, and numbness. Acting quickly can prevent serious harm,